Today on Inside Utah Politics, judging the judges. More than 50 judges are up for attention across the state this election year, and a local commission is helping voters make an informed decision. We'll explain how. And the 7-day rolling average for positive COVID-19 tests in Utah tops 1,000 for the first time. What should we make of this second wave? Our panel debates.
Time now for Inside Utah Politics.
Thanks so much for joining us. I'm Glenn Mills. It is time to go inside Utah politics. We begin today with Jennifer Yim. She is the Executive Director of the Utah Judicial Performance Evaluation Commission. Jennifer, welcome to the show. Thanks for being here.
Thanks so much for having me, Glenn.
You guys play a very important role in the election time because a lot of times we get to the judges and we say, I don't know anything about these people. What should I do? And that's where you come in. Talk about JPEC Defined. What is it that you guys do?
We are an independent state commission that evaluates the performance of judges for voters.
What is the history of your organization? Because I've had you on the show in previous years. How long have you been doing this? How did it all come about?
Okay, yes, that's true. Thanks for having me back. We were begun in 2008 by the state legislature. They established this independent commission. Judges have been evaluated for decades in Utah, but for many years they were evaluated by the Utah judiciary itself. And in 2008, a new independent commission was established to evaluate the performance of judges for voters.
Let's talk a little bit about the evaluation process. It's quite lengthy. There are a lot of moving parts to it. How does the process go from start to finish when you then make your recommendations to the public on how they should vote?
Well, it's an exhaustive process. We start when the judge is first appointed, and we do continuous evaluations up until they're on the retention evaluation, and then again if they happen to be retained. So we start by tracking the judge's calendar and collecting information about the people who appear regularly in the judge's court. That's attorneys, court staff, bailiffs, interpreters, allied professionals who find themselves regularly in a judge's court. We survey all of them, maybe 250 people or more for many judges in the state.
And then you put that all together in one report for voters to go look at.
We do. We also do courtroom observation with lay trained observers across the state. And we also supplement that with a tracking of objective material and standards for people to consider.
Okay, let's focus in on this year. How many judges across the state are up for retention? Some of those are statewide, others not. Explain that to us.
Great. There are 59 judges on a ballot somewhere in the state of Utah. Every voter will have at least 7 judges on their ballots. Those are our appellate judges, our Court of Appeals and Utah Supreme Court justices. And the rest of their ballot, maybe people will see up to 20 judges on their ballot, depending on the locale that they're voting in.
And what is the recommendation that voters will see when they go to your website and look at these 59 judges? Because you either recommend to retain or not to retain. That's
exactly right. So when a voter would go to judges.utah.gov and take a look at the information about the judges on their ballot, they can choose the county they live in. They'll see all the judges that will be on their ballots, and they do see a recommendation. Voters should think about that recommendation as whether or not the judge passes minimum performance standards. Commissioners are required by law to vote to retain the judge if they pass minimum performance standards. And so that's a nice way to sort of understand that. But in addition to that information, you can find as much or as little information as you want about the judge. A narrative describing the judge's strengths and weaknesses, information about the minimum performance standards that we measure. You can even see the survey questions that we ask and the average scores for each one of those questions.
And I think you said, I just want to hit on this again, that you can put in your own information and it will show you which judges will appear on your ballot before waiting for the ballot to see which ones are on there, or is that not the case?
We provide county-specific information.
Okay.
For most people, that will be all of the judges on their ballots, yes.
Got it. So this year, the recommendation is to retain all 59 judges, is that correct?
It's true. Every judge who's on the ballot has a recommendation to retain.
However, that's not necessarily unanimous on all of them, though.
Right.
So you may find on some where some dissent on their record.
Yes, so there are some judges where there's a mixed yes vote, where you can see those vote counts right on the ballot. It's right there with that recommendation to retain.
Okay, let's talk a little bit about historically how the retain versus not retain recommendation has worked out, because and also get into this. A judge actually has the opportunity to go over what you provide before they decide whether or not they want to run again. So it's possible they see that you're going to recommend that they not be retained, and then they just decide not to run again. So talk us through that.
That's exactly right, Glenn. So it's important for voters to know, because when they go to our website, they do see that all of the recommendations for judges are all in the recommend side, but judges have an opportunity to see their evaluation reports from JPEC, the results of their evaluation, before they decide whether to run for the retention election or not. And while judges have any number of reasons for choosing to leave the bench, it is also true that a judge who receives a negative recommendation for retention is most likely to resign or retire rather than seek the retention election.
Okay, we did not see that in 2016, because I remember that there was a judge that was recommended not be retained, but she decided to continue on to the election anyway.
Yes, and that's absolutely their choice. JPEC does not try to dissuade or encourage a judge to make any particular decision. It's completely up to the judge.
And is that the first time you had encountered that specific scenario in the time of JPEC?
It is. It's the only time that a judge has ever run on a negative retention.
Okay. And if I remember right, she ended up being retained in the election.
Yes, it was a much closer margin,
Okay.
but you're correct.
So make a pitch for this, because like I said at the beginning, oftentimes we're going through the ballot, moving through everything, you know, we're familiar with candidates, the amendments and other issues on the ballot, but you get to the judges and you just kind of get stuck. So make a pitch for why this is so important for voters to make an informed decision on this in the upcoming election.
We don't have to look far, do we, to see that people care in Utah deeply about their justice system. Here is an opportunity for people to weigh in on their justice system, to take a moment to go to judges.utah.gov, to look at the judges who they'll find on their ballot and make an informed choice about whether you think this judge should serve another term of office. I think it's a great, whether you vote yes or no, the decision is yours. It's your opportunity to weigh in on your justice system and to help Utah have the best court system in the nation. Okay,
and why don't you give us that website one more time? You have said it a couple times, but always good to repeat that as many times as possible.
People can go to judges.utah.gov to find comprehensive information about all the judges on their ballots.
All right, this is an important part of the ballot and something that we all should take very seriously. Jennifer, appreciate your time. Thanks so much for being here today.
Thank you, Glenn. I appreciate the opportunity.
You bet. Still to come, President Trump and Joe Biden went head-to-head for the first time during the week. Our panel weighing in on what went down. But first, 100 million rapid COVID-19 tests on the way for all 50 states to put to use how they see fit, how it could help keep schools open during the pandemic. Welcome back. The federal government announcing it will send 100 million rapid coronavirus tests to all 50 states free of charge to ensure the safety and security of their communities while safely reopening. Many states have indicated they will use those tests to support in-person education. Washington correspondent Anna Warnicki reports.
Very simple, comes in a little card with a little strip.
Assistant Secretary for Health Admiral Brett Giroir says 15 minutes is all you'll need to know if you have COVID-19.
They come with a swab, they come with everything you need.
On Monday, President Trump announced that he's sending 150 million of these rapid tests to all 50 states free of charge.
This continues our critical effort to use testing to protect high-risk communities.
The Trump administration says states will decide the best way to use the tests based on the circumstances they face.
This is going to be huge for us to have this.
Texas State Representative Dan Huberty says the state has already mapped out a plan to send the tests to the areas most in need.
We have regional service centers in each one of our areas, and there's 20 of them in the state of Texas.
And Mississippi Governor Tate Reeves says in his state, the priority will be students and teachers.
What these rapid tests will allow us to do is to regularly test teachers so that they have peace of mind, so that they can get in the classroom and focus on teaching and not worry about the virus.
The White House says 6.5 million tests will be deployed to all 50 states this week, and then another 10 million will be sent every week until the 150 million tests run out. In Washington, I'm Anna Warnicki.
Weeks away from the presidential election, a new Gallup poll finds 3 in 5 Americans favor abolishing the Electoral College. It's the highest level of support in nearly 10 years, but the issue is partisan, with nearly 90% of Democrats polled in support compared to about 20% of Republicans. Washington correspondent Jesse Tenor reports on the future of the Electoral College.
The Electoral College is just no longer worth a hoot.
If it were up to Tennessee Congressman Steve Cohen, the next constitutional amendment would abolish the Electoral College.
It was conceived in sin. It gives the small states much greater influence than they should have in our system.
2 years ago, Cohen proposed a constitutional amendment to replace the Electoral College with a popular vote system. This after President Trump became the 4th candidate in history to win the Electoral College, but not the popular vote.
If it was a popular election, every vote would count, and there'd be no flyover states.
But changes to the Constitution require support from 2/3 of both houses of Congress and 3/4 of the 50 states.
It's hard to amend.
An easier way is in the works. States can adopt the National Popular Vote Agreement to award all of their electoral votes to the presidential candidate who wins the overall popular vote. But so far, only 15 have signed on.
If that were to go into effect, I think voters in their states would be pretty angry.
Hans von Spakovsky, a senior legal fellow with the Heritage Foundation, says Congress would also need to approve this, which he thinks is unlikely. Von Spakovsky says what's more likely is a legal challenge making its way to the U.S. Supreme Court to keep the Electoral College intact.
And has given us stable government for over 200 years.
Arguing the current system should stay put. In Washington, I'm Jesse Tenor.
Still to come, new COVID cases are skyrocketing in Utah. What's the cause and what's the path forward? Our panel debates after the break.
You're watching Inside Utah Politics.
Time now to debate some of the big stories of the week with the Inside Utah Politics panel. This week we have State Representative Suzanne Harrison and former House Speaker Greg Hughes. Great to have both of you on the show. Thanks for being here.
Thank you.
Thank you.
All right, let's get right to one of the big stories of the week, and that is our daily rolling average, 7-day average of COVID-19 cases. We're seeing this second wave, as far as confirmed numbers are concerned, much higher than the first wave. We have hit over 1,000 on the daily average for the first time, that 7-day average. Former Speaker Hughes, let's start with you. What do you make of that?
So this is that average matters because what you don't want to see happen is you have a highly contagious virus. Those that are vulnerable, that might find themselves in a hospital or more critically in an ICU bed, intensive care unit bed, we have only so many beds, and that capacity, if full, if you saw what happened to Italy during the beginning part of the year, we cannot see our hospitals overrun. But this is the part, and this is the thing that I think 9 months later after January when we saw some of these things, you have to stare at that capacity of your intensive care unit beds. I think as important as what your infection rate is for a virus that we don't have an immunity against, we have to see what that hospital capacity looks like, and that's what you have to stand guard and watch. And I'm not seeing commensurately the number of cases as we're seeing this. Some people don't really feel it as much, but they're getting tested. If we're not seeing the overrun inside of those hospitals and in those intensive care unit beds, then I want us to be very cautious. I'm hoping we'll be cautious not to destroy our economy or interrupt our children's critical opportunities for education, public education, things like that. And even the hospitals being empty and not being able to get other critical care that we need. I think you have to measure not just infection rates. That can't be the end-all be-all. It is really what is its impact on our healthcare delivery.
Okay, but what we see is when we start to see numbers go up, the hospitalizations tend to lag about 2 weeks or so. Representative Harrison, that's something you see on the front lines. Give us an idea of what you're seeing.
You know, in my day job, I'm a medical doctor on the front lines, and actually today I was in a COVID ICU here in the Valley, and they are full, and I talked to nurses and doctors that are exhausted. You know, I think we have to keep in mind that an ICU bed doesn't take care of patients. It's those trained experts and health professionals that take care of patients. And what I heard today and what I'm hearing across the board is that people on our front lines are exhausted. And I think this escalating number of cases that does create subsequent increase in hospitalizations has to be a call to action on all of us to redouble our efforts and make sure that we're contributing to the solution and helping make sure through choices of our own in terms of wearing masks and washing your hands and staying physically distant, that we're helping keep our neighbors safe. We've been doing this a long time, and I get it that everyone is frustrated and tired, but we have to tackle this together. And I really hope that people will look out for their neighbor by doing these simple things, because our hospital systems are strained and stressed.
Let's get a little more into that, because there's clear data that this is being driven by the younger population, a population that isn't impacted the same way as the older population by this virus. When we talk about solutions, Greg, where do we go?
So I would never counter what Dr. Harrison's saying in terms of the ICUs that she's visiting and what she's seeing there, but I do think it's important for Utahns to know our ICU bed capacity is not overrun when we are not full. We may be in a respective ICU unit at a respective hospital, but certainly our capacity is there. We are not even close to reaching in excess of that capacity. But we also have smart hospitals that are preparing for or contemplating expanding capacity if we ever got to that moment. So when we look at that, I think that is something that we can't ignore. If we are worried, if we think that there's not going to be infection rates at all, as you've pointed out, we have younger populations that don't feel the symptoms the same. A comorbidity rate, which is a fancy word of saying you may have other underlying health issues. They say, CDC saying it's 2.6, so more than 2 other health-related issues that compound getting this virus and finding your way to a hospital. We have young people that aren't feeling it maybe the same way. We have elderly people that certainly do.
Okay, let's focus
so I think you got to be critical about how you're protecting people or how you're making sure the right people are being not exposed to this virus and having access to health care.
Let's focus on that, though. The younger people, the ones that aren't going to be impacted the same way, could they be acting more responsibly?
Certainly. Well, look, I think anytime you're going to bring people together, we could all stay inside from now until, I don't know, the virus, a vaccine shows up or something happens. The day you get outside or get around people, if you're not taking any precautions or you're not, then you are going to see these cases go up. There's a 99% recovery rate if you do get COVID-19. I think this is with us for some time. I think we have to be taking precautions and being smarter. And I do think that young people, my daughter, she's 21 years old, and we have this conversation. I know a lot of families are having this now. You have to take precautions you might not have taken in the past. That is certainly the case. But what I don't want people to think is that this is any more critical or less critical. Look, you can't let these kids not go to school. We cannot interrupt education. If we think that every child has a stay-at-home parent and that this is just going to work seamlessly, it's not. It is going to have its impact. If you have other issues or needs in a hospital, you can't be turned away for cancer treatments or other things. There are other issues, health-related issues, and a healthcare strategy that you can't ignore at the same time we're staring at this virus and its infection rate. So we got to ask young people to take precautions, be stronger in that area. But let's not overblow it or let panic seep in. That's the last thing.
Representative Harrison, let's bring you in on that. You have kids that go to the same school I do, the same school the speaker, former speaker does. Right now, our children are learning online only because of what happened at the high school. What about the other consequences outside of this?
You know what? We do need to work together to get kids back in class. It is critical. There's no substitute for an amazing teacher in the classroom with kids learning in the classroom. But again, we've got to take personal responsibility and do our part to help quell this virus. You know what? I think it's a misnomer and misinformation that this virus is only impacting older folks. The average age of hospitalization in this state is 53 years old. That means just as many people are younger and just as many people are older. We have got to be realistic that we don't understand fully this virus. We know it impacts some in a devastating way, and even, people are dying. And something as simple as wearing a mask when you're going to the grocery store can save lives. And I call on the Utahns that I know and love, that love their neighbors, to help be part of the solution. We've done a great job in Utah of not shutting things down. We've not been extreme, but our numbers ticking up and our deaths ticking up need to be a call to action and vigilance to continue to do your part to help save lives here in Utah.
We could go on this for quite a while, and I wish we had more time, but I want to hit on a couple other topics while I have you here and while we have the time. State Auditor John Dougal putting out his audit on the state response. This is something the both of you are really hitting heavy on for months now. So we've had a chance to look at his audit, and he came up with a lot of the same things I've heard come from the two of you. So in 30 seconds each, tell me what your assessment is of the audit from John Dougal. Greg, let's start with you.
Look, I laugh because 30 seconds to talk about such a complex issue, for me especially, that's pretty hard. I would just say this, a state of emergency, and when you're asking your state officials to act while time is of the essence, we have statutes that contemplate those moments. What we are living through right now doesn't match those moments of earthquakes, fires, wildfires, floods, and there is much to learn from what actions the state took and avoiding out procurement processes, not using some of the statutory processes we've set up when we spend taxpayer money. What this audit shows is that in many cases, the state did what it needed to do in terms of being under the gun and seeing that they needed the personal protection equipment, things like that. But what we can take from this, and I'm a former speaker, I'm not a speaker now, but what I would say to my former colleagues is that it is time to revisit the statute for a state of emergency and what qualifies for that, and what circumstances the executive branch can summarily just say, we're not going to look at we can throw out any statute we want, whenever we want. We're going to have to stare at that given the times that we're in. We have health departments as well, where their orders, without even a state of emergency, have the effect of penalty of civil law as well as criminal law, whatever that order may be. I think it's time to stare at that process as well, make sure we're getting that right. I think this audit, hindsight's 20/20, but there's a lot that we can identify and learn from. Hey, I think we love emergency preparedness as a culture. We like to be prepared. I think what this audit says ultimately is we got to be better prepared.
Okay, Representative Harrison, something you've always talked about, the audit confirming insufficient planning, no clear chain of command early on. Your thoughts?
I agree with a lot of what Greg already said, and I think we want our government to be responsive and nimble in any type of emergency, but we also owe it to taxpayers to be transparent and accountable with every tax dollar. And I think it's critical that we look at mistakes made and learn from them and adjust statute accordingly so that every tax dollar is spent in a way that truly helps Utah families and is spent in a way that gives every company a fair shake at having an opportunity to participate in the solutions and contracts. It needs to be an open process and a fair shake.
Okay, we are going to have to end it on that note. I wanted to get to more, but great conversation. Appreciate having both of you with us. Thanks for being here.
Thank
We'll be right
you.
back after the break. Stay with us. We leave you now with a look at what's on the radar in the world of politics. The one and only vice presidential debate is coming to our state this week. It's set for Wednesday at the University of Utah. Mail-in ballots go out the following week. Watch for those to start arriving the week of October 12th. And the general election is Tuesday, November 3rd. Make sure to connect with me on social media. I'd like to know what you think of this show and other issues that are important to you. You can email me at InsideUtahPolitics@abc4.com. You can also follow me on Twitter and Facebook. Just log on and search Glenn Mills ABC4. Thanks so much for making us part of your day. We hope to see you again next week as we go inside Utah politics.